Thank you, Business World, for organizing this and having such a fantastic panel early in the morning itself. And I'm honored to have such a panel and where I'm asked to moderate, sitting with all the luminaries. Yeah, I'll try to first stick to the time. We have a lot to cover, but I'll make sure that we are able to get the best from them while making sure we don't exceed. Here at healthcare quality, when we look at, it's really how do we look at quality and healthcare? There are multiple parameters. It's not just safety. It's not just being patient-centric. It's not just being on time. It's not just the effectiveness. Right? And so that's where, as I see healthcare quality, it's a combination of a lot of factors which play together. And given that healthcare itself is so complex, and when we talk about healthcare delivery, the entire end-to-end healthcare, quality definitely is something which is looking at all dimensions. And that is what we are trying to cover in this panel with our esteemed panelists, that how do we look at healthcare quality and how do we ensure that we are really getting onto the top. Okay, I'll start. First question for you, Dr. Swaroop. As a leader in one of the India's premier healthcare institutions, Sir Gangaram Hospital, how do you define and cultivate a culture of quality beyond mere certification? It will be great if you can share any specific initiatives or practices implemented at your hospital that have contributed to fostering a culture of excellence in healthcare delivery.
Well, hello. Well, thank you very much for having me on this panel. Now you see, quality, if we go by the textbook, there are definite parameters of health quality, ranging from infant mortality rate, maternal mortality rate, mental health, and so on and so forth. Now, in developed countries, these parameters have been given up, but unfortunately, we still, in this country, have to look at these basic parameters if we are talking of healthcare quality as a whole in the country. Now, since you have specifically said quality in Gangaram Hospital, that again changes the scenario, because firstly, it's a totally urban setup. It's one of the super specialty, multi-speciality hospital. So the quality parameters for us are slightly different from what it is to the rest of the country. Now, as far as we are concerned, quality starts as soon as the patient enters the hospital, and how he is received, what is the patient satisfaction, is there adequate digitalization, is there adequate technology which is available to the patient, because patients who come to our hospital or to comparative hospital are now very discerning, and the younger generation, as well, you are part of it, are now so much dependent on technology that one of the quality parameters is how he is looked after, how his card is made, how his admission is handled, how he is directed to the hospital doctors. That is one of the, as far as now being the chairman, I feel that has become one of the paramount criterias of quality. So we start from the beginning. Then, of course, as far as medical specialists are concerned, there is no ambiguity about that. You have to have highly qualified, as far as possible, highly experienced doctors in various specialities and subspecialties. Now, as you are all aware, medicine, general medicine as we knew it 20 years ago does not exist. It has been subdivided into so many subspecialties, gastroenterology, pulmonology, hematology, etc., that quality is definitely on the rise because all these people are super specialists. Apart from doing their MD medicine, they have super specialized in their subspecialties. So that is one aspect of healthcare professionals. Once the patient has been seen, we are, as you know, more dependent on diagnostics. And that is where quality again plays a very significant role. Diagnostics are the mainstay of our diagnosis and treatment. And the world of diagnostics is so dynamic that it is changing every minute, every second. And we have to keep abreast as far as possible within our limitations. But that is one big area where a quality control is a must. And as far as your last portion of what we have done, we are trying within our constraints of having the best of everything. And once you have the best, it is expected that quality will follow. So that is what is our initiative.
Thank you, Dr. Swaroop. I think when we talk about quality, definitely the certifications is what comes to the mind immediately. And that's where my first question to Urvashi is, how does NITI Ayog envision in fostering a cultural shift within healthcare institutions to look at or prioritize quality improvement beyond just the certifications?
Okay, so before I answer your question directly, I think just a couple of context setting facts for the health system that we have in our country. So firstly, it's a very heterogeneous health system. When you talk of healthcare, you're not just talking of big hospitals, right? You're talking about all sorts of healthcare establishments, smaller establishments. You're talking of setups, clinics in the primary sector. So that is one layer of complexity that, it's a very, very heterogeneous space. The second is that there is still a lot of informality in our health sector. If you see the primary care in rural areas, it is still dominated by a lot of informal providers, or these are very small establishments, 2-bedded, 3-bedded, even in tier 2, tier 3. So we have that challenge, that layer of complexity which is added on. And that is why certification as a basic is very, very important, because, in healthcare, you have to meet at least certain basics. And I think that is what we're still grappling with a large part of our health system. These are not the organized, big, hospitals that we're talking about, right? We're talking about the much smaller establishments in smaller cities, towns, and rural areas as well. So we're still grappling there with the basics, and therefore certification, etc., is still very important. But I think we're also at the other end, where we have hospitals and healthcare facilities which are truly at the cutting edge. And I think there, of course, we're getting more sophisticated in how we are thinking about patient satisfaction. Now, again, this is the other unique thing about the healthcare sector, that, your customer is not a typical customer. There's a huge information asymmetry in this sector. So sometimes as a patient, I don't even really know, what does quality mean, right? Beyond the things of, okay, how easy is my registration, or how easy is it to access the doctor, or how much time does the doctor spend with me. So those are, of course, things that, most of us can sort of talk about. But beyond that, what does quality in healthcare entail is often very difficult for a lay person to, necessarily be able to judge and assess. So I think that is also an aspect that we are focusing on, is empowering patients themselves to better understand and be able to differentiate what is quality, what is not, in the healthcare space.
Thank you, Urvashi. Next question to Dr. Aggarwal. As the president of Consortium of Accredited Healthcare Organizations, CAHO, what strategies does CAHO advocate to encourage healthcare institutions to embrace a culture of continuous quality improvement beyond just the accreditation requirements which are there?
Yeah. So good morning, and thank you, Business World, for having me here. See, I think the first thing is to understand the role that is being played by accreditation to promote patient safety and quality. And to understand this, let's realize that a country like United States, which have many like Ganga hospitals and the top hospitals like ours, that is being represented by a country like United States. And in that country, and which is spending the GDP of my country on their healthcare, unlike we are in the lowest strata. And the preventable medical errors are the third leading cause of death in that country. So somewhere along the line, we have to understand that accreditation and patient safety probably are not going hand in hand. And like what Madam previous speaker said about quality, I think the major part of quality has to be linked to the preventable medical harm. And that's the focus that what we are trying to advocate is, first thing is the realization by the healthcare institutions that when they get accreditation, it is not the end of their quality journey, it is the beginning of their quality journey. Unfortunately, most hospitals are just trying to understand how do I get the stamp of accreditation, and therefore even those practices are given up soon after or 1 month after the accreditation is over. I had been the co-chair of the accreditation committee, and I can tell you almost every institution coming for re-accreditation or surveillance, instead of showing improvement, was showing deterioration. So I think the important thing is for us also to understand what is accreditation. Accreditation is an evaluation of your good practices. And we are not focusing on good practices in every department and function. Rather, we are focusing on how do I pass this exam. And that's why I'll say that probably the shift of focus, accreditation has given a very huge amount of, I would say, focus on the issue of patient safety. It has produced the whole breed of people whom we call as quality managers. But the quality in cardiology will not be practiced, cannot be done by that quality manager. That quality manager can only show him the mirror. And his position hierarchical is typically not that high. So we have to understand that let us try to focus on the issues of quality and patient safety. They are linked together to every department and every function. So for example, if we're coming to admission and discharge, it is mainly the front office manager, etc., who should drive this. While what is happening in cardiology, orthopedics, neurology, or any other specialty, and I think Ajay Swaroop raised a very nice point regarding the infant mortality. Now those are indicators for the public health issues, and that's where the country should be looking at how do I improve these in spite of my having such great hospitals. So my just simple take is, let's create focus on good practices rather than accreditation.
Thank you, Dr. Aggarwal. Yes, focus on good practices. So That was Dr. Aggarwal from the healthcare organization side. Moving on, let's look at the healthcare provider side. So, to Mr. Khetarpal, as a director of Association of Healthcare Providers India, AHPI, how do you look at how does AHPI promote a cultural transformation within the healthcare institutions, just going beyond the compliance or going beyond the regulations, and how does it emphasize a commitment to excellence in the patient care?
Yeah, thank you, Gaurav. Very good morning to all of you, and thank you, Business World, for the opportunity. First of all, I think I would just give you a brief about AHPI. AHPI is Association of Healthcare Providers India, and we are a society, not-for-profit organization, and we represent majority of private healthcare institutions in the country. We have 20 state chapters, that is AHPI state chapters, and across the country we have approximately 20,000 hospitals as members. So AHPI is basically, the main forte is we are into advocacy, capacity building, training, and various other things. Now, you cannot bring a cultural change. And secondly, of course, educational programs. You need to have, educational programs within the organization and across the healthcare. Third thing is the quality improvement initiatives. As Dr. Aggarwal also mentioned that after achieving certification or accreditation, you become relaxed, and then people think that it is only the job of the quality manager. So everybody becomes complacent and they are relaxed. So I think even after you achieve accreditation, that culture has to, quality culture has to be imbibed. It has to be among all the, at all levels of staff. And you need to keep on it, because quality is not a one-time affair. It is not a one-time process. You achieve it and then you forget it. But then you need to continuously work towards it and always strive for continuous quality improvement. And another most important thing is that patient engagement and patient feedback. See, if you want to create a culture of quality in the organization, it is very important that you continuously interact with the patient, you engage the patient, you take the regular feedback. Those feedbacks help you to improve. It is not that, feedback can be a positive feedback, can be a negative feedback, or it can be a comment. So feedbacks are very important, patient engagement and patient feedback. Then another thing is, somebody who is doing good and you need to pat at his back. So likewise, if somebody is not doing good, so bouquets and big bats, both are important. And awards and recognition for those who are doing good in the organization, so they continue to maintain the culture of quality. And another thing is the collaboration with the stakeholders and knowledge sharing best practices among the hospitals, among the stakeholders, also help you to improve the culture of quality. And lastly, I would say that the ethical standards and professionalism, it is very, very important. So what is a culture of quality? A culture is nothing but your values, your beliefs, your behavior. This is what a culture is. So culture of quality, we talk not only of quality and safety, they go together. Dr. Vijay Aggarwal also mentioned, because they are at the core, core of your organization, quality and safety. So ethical standards, following, and addressing the ethical dilemmas in the institute, and maintaining professionalism by each and every staff, especially by the doctors. So these are very, very important to, maintain the cultural and bring the cultural transformation in the organization.
Thank you, Mr. Khetarpal. Yes, maintaining the culture of quality, that's important. Moving on, let's look at a specific organization that way. So, Dr. Kirti, as a representative of Metropolis Healthcare, how does your organization foster a culture that values quality and works towards continuous improvement in the diagnostic services beyond just meeting the accreditation standards?
Yeah, so thank you for this opportunity and happy to share our thoughts. So, as everybody said, all the esteemed panelists made some very cutting points. Somebody spoke about super specialty, somebody spoke about, just accreditation not being the end, but being the beginning. Someone spoke about, bouquets and brickbats. But so that's what Metropolis has done, right? We've taken the bull by the horn. And we have something called as a complaint meeting or a customer first meeting or a patient first meeting every month. It was started by Dr. Sushil Shah, chairman, 40 years back, and we continue to live that legacy. Now, what happens in that, as was rightly pointed out by many of my co-panelists, that sometimes you may put all the systems in place. You may be having the excellent quality metrics, you may be having excellent quality indicators, you may be having a zero NC audit, you may be having, 5-6 accreditations to your credit, and still a patient is unhappy or a doctor is unhappy or a report has not gone on time or not gone right or a service has not been rendered correctly and the quality has not been maintained, the sublime quality has not been maintained, and somebody raises a voice and says, look here, you didn't do a good job with my patient or with me. One thing is to just ignore it, right? And say, push it under the carpet and say, hey, we have excellent quality. We are, accredited. We have these quality indicators or whatever. And the other thing is to say that, no, we hear you and we will look into the matter and we will get back to you. Okay, so what we do is that we have a session every month wherein we take in from all the cross functions, whether it was a pre-analytical, analytical, post-analytical, whether it was related just to perception or there was actually an error, or whether it was related to a kit not being available or to a home visit not being done on time or to an amended report being released or an addendum report being released, anywhere where there has been a deviation from the quality metrics, from the quality line, it gets called out. And it doesn't get called out in a bad manner. It gets called out in a good manner that, look, there was a problem. Either we need to look at the process or we need to look at the person or we need to look at the training. The talent, is the right talent on the ground? Has that talent been trained? Has that talent been sensitized to what the requirement is? And then are we able to deliver the quality that we have got a star for? So just having an NABL logo or a CAP logo, but are you following all those indices every day when no one is watching? And that can only come out when you address the complaints and you look at them, as was rightly said. And one last point I'd like to make, that in our company, quality is not at the bottom or in the side. It's a very big hierarchical position. We have Chief Quality Officer, Dr. Puneet, my colleague, and I'm the Chief Scientific Officer, and Dr. Nilesh, the Chief of Science and Innovation Quality. So we are in the CXO team. So the leadership has got the quality head. So there is no way quality can get ignored in Metropolis because in the leadership, 3 people are actually driving quality. Yeah. So that's my humble submission.
Thank you, Dr. Kirti. So, we looked at what we got the inputs as the culture and how that culture is really moving inside the organization around quality. Moving to how to actually get that culture moving and how do you really get it done? So, Dr. Swaroop, beyond the compliances, what role do you believe that leadership and culture can really play in the continuous quality improvement? And how do you empower and engage the actual healthcare providers, the frontline workers in picking up and championing this culture of excellence and accountability?
Well, we've just been told very clearly by the lady that we've got to have leaders in position who are ensuring quality rather than calling them, managers or something of that sort. They should be the directors, because just having a standard operating procedure in place and getting accreditation is not enough if people are not following it. And how do you ensure that people follow standard SOPs? One method is that you try to get everybody on board, hammer the importance of quality so that starting from the lowest person who's wheeling in the patient to the highest person who's looking after the patient, they are all sensitized that there is something, there is a concept of quality, and that has to be nurtured, nourished. So that is, I feel, the best way to ensure quality in any organization. And of course, there is the other flip side to is that you have a little strictness. People, as they set carrot and stick policy, people who are departments who are adhering to good practices should be recognized, should be rewarded, while people who are lagging behind have to be initially counseled and then, well, I should not say it, we go a step further and ask them to either improve or leave. So that is how, in fact, it is a constant struggle. It is a constant struggle for every or any organization. Leave aside healthcare. It is very important in healthcare, but that is true for any organization, anywhere in the world, that you've got to maintain quality. Just having once a certification is not enough, because that has no meaning. These certifications are meant to tell you that these are the standard indicators of quality. Now, how you follow them, how you implement them is up to the organization. I mean, you've been certified and you're going to be recertified after 3 years, but that doesn't mean that in that intervening period you keep on doing whatever you feel like. You've got to keep on improving. In fact, as one of the speakers said, once you are reassessed, then majority of the negative points should have been closed by that time, and no new fallacies should have crept in. That is the whole purpose, and that will denote which organization is genuinely following the concept of quality or which doesn't just wants the emblems on their pad. So it's a continuous process. It's a continuous process, and what methodology you adopt is, well, it depends on the top leadership.
Thank you. Thank you, Dr. Swaroop. Moving to the policy side, is there anything that can be really looked at from a policy level? So, Ms. Urvashi, can you elaborate on any specific policy interventions or incentives that NITI Ayog is considering to promote this holistic culture of healthcare quality across public and private providers?
Yeah, so, like I said, that given our heterogeneity, even the interventions, have to depend on what type of provider we're talking about, what level of the health system, and there's obviously different kinds of initiatives catered to each of these. So if I see within the public sector, if we just look at the primary care level, which is I think a very important level, and should become an even more important level for the country, because you can't care for such a large population only through hospitals. So I think if the primary care facilities, we have brought in a lot of these guidelines. For instance, there's a Kayakalp. It's something called a Kayakalp guideline, where through a process of it might be the basics, but like I said, in a lot of these facilities we are still grappling at the basics. We are trying to bring about an improvement in the general atmosphere of these facilities, and the quality of services, and of course the safety of patients, which is the ultimate really in a healthcare setting. And interestingly, we do use rewards and recognition and incentivization through these guidelines, and to what extent facilities are adhering to these guidelines, and we've seen fairly significant improvements in many of the facilities, because after we have started actually putting these in place and monitoring. So I think that is definitely a route that we are taking. We have a separate initiative for district hospitals, And there we have also built in patient satisfaction. So, through mobile applications, we have something called Mera Aspatal, where people can actually provide their feedback. I mean, that is something we're still building on, and we keep improving that. But the idea is that you can provide feedback on district hospitals, and in fact, NITI Ayog has done a fairly rigorous assessment of all these hospitals. We haven't necessarily put out a ranking because we're still seeing what makes sense, and sometimes it's hard to compare like for like across states, across the size of these hospitals. Various factors are there, but we've certainly done a very rigorous assessment, and we provided that feedback to states. So that's happening, at the district hospital level. So I think at each level we have separate kinds of initiatives. But like I said, we're still grappling with a lot of the basics in a large part, of our country still, especially at the primary, care level. And I think we need to have significant improvements there. But also, I think, obviously, when you talk about quality in healthcare, you cannot talk about it without addressing the quality of health personnel, the medical personnel. So that is also something that policies, do have a direct impact on. That, we're obviously trying to produce not just more qualified health personnel, but also those with better quality. Because that is again a big challenge in many parts of the country. So equipment, medical equipment, the kind of devices we are using, the standardization, so I think there's so many different aspects when you say quality, and policies are impacting all of these, and we have different kinds of initiatives for each of these. I think for the private sector, like I said, where it's informal or it's still pretty small, it's unorganized, there I think we have a real challenge. Because the larger, more formal, more organized setups, they anyway have a clear incentive to, also provide better quality. And they have the systems and processes by and large in place, or they will be in place by virtue of even just learning from each other. But I think the smaller establishments, the more informal ones, we still have a big challenge because those are still providing healthcare to large parts of the population. So I think that's where we haven't fully found all the solutions yet. But we're certainly focusing on that, and we're seeing how we can integrate those setups with the overall health system.
Thank you. Given, again, we are talking about the culture and how do we percolate it, Dr. Aggarwal, if you can cite some examples of any innovative approaches or best practices that CAHO has observed or promoted to foster this culture of quality improvement within the organizations.
Yeah, well, there are many, but I'll just say, before I come to the point, that, for example, Dr. Ajay Swaroop mentioned that when, for example, somebody is not following practices, good practices, they may even come to a level when you may have to ask that person to leave. But the ground root reality today is that we have such dearth of specialists and the doctors all across the country that even if you are leaving one institution, he's going to be working in another institution and doing the same practice. So the issue is this, that today we have to still, I must congratulate that already the number of postgraduate seats have increased in the recent past. However, I think this whole issue has to be looked at still much more seriously, that we do not have enough number of specialists and the doctors, and their working conditions are under so much stress that today there is a decline in the number of people who are coming to take up the medical profession. So that's altogether a different thing, and it will hugely impact the way we are kind of practicing or doing anything. As regarding what we are able to do is, first of all, to understand that at one time the healthcare delivery was only an issue between the doctor and the patient. Now it has become a multi-stakeholder delivery. It has become like a teamwork. And therefore, every department and every function, and you see every product in the hospital is a different product. It is like, somebody who is coming for a delivery has different expectations, different problems as compared to, let's say, a person who is coming for a knee replacement or who is coming for an ENT checkup. While, one is trying to bring everything together under one kind, as if there is a kind of a common product that I am trying to kind of deliver, it is not. It is, everything is different. And therefore, we have been promoting that there have to be a monthly departmental and functional meeting in every department. So say that they understand what are the nuances of their department, what are the feedback from their department, and to start working on it. So these are the areas where there has been no scope of capacity building. Leave aside big institutions, especially in hundreds and thousands of small standalone hospitals, they had no area of capacity building. So CAHO has worked towards bringing a whole army of people who are trained into various aspects of these functions. And therefore today we run more than 45 training programs which are very, very well adopted and recognized. We hold a number of annual conventions, and over a period of time, we can say that we have been able to inculcate quality and patient safety as a very distinct discipline beyond accreditation. So we are working, for example, we have been holding monthly webinar on every first Tuesday at 5 p.m. with ISQA. ISQA is the International Society for Quality, which does the accreditation of the accreditation bodies. So there is a CAHO ISQA webinar on every first Tuesday, and we have requested hospitals to start making every first Tuesday 5 p.m. as a monthly quality meeting, where they should call people from their other departments. They can start listening to the concepts of quality, and even the nearby small hospitals. So we need to reach out to each and every segment of the healthcare engineers, nurses, doctors, technicians, paramedics, and reach out to them to sensitize them about the issues of patient quality. And that's what we are doing.
Thank you, Dr. Aggarwal. We have run out of that time, but can we have 5 more minutes or? Yeah, I'll just wrap up. Okay. So very quickly, Mr. Khetarpal, if you can tell us on how AHPI is looking to collaborate with other stakeholders, whether it is government agencies, industry associations, patient advocacy groups, and everybody to have this culture of healthcare quality improvement across the system.
First of all, I would like to say that we are not looking to collaborate. We have already collaborated with various stakeholders, because it is an era of collaboration. You need to involve people and you need to work hand in hand. So AHPI has collaborated with various industry partners, with the government, and with the accreditation body like NABH. With the AHPI advocacy, we have been successful in implementing this QR code on the 300 essential drugs, which ensures patient safety. Then we have also collaborated AHPI and ISRO collaboration. So we are working on doing a study on air quality monitoring using the space inputs. We are working with ISRO. So this is a collaboration. Then we, Quality Council of India, under its board, NABET, National Accreditation Board for Education and Training. So they involved AHPI in providing resources for conducting assessment of nursing and paramedical institutions in the state of Uttar Pradesh. That is, for grading of the institutions. There are about 700 of nursing and paramedic institutions in the UP district, in UP, across all the districts. So we provided them resources. This is again a collaboration. And then, of course, AHPI is part of various high-powered committees, a committee, quality steering committee set up by the National Health Authority. AHPI is a part of it. and AHPI is a part of technical committee on grading of hospitals, which committee is constituted by NABH. Dr. Alexander Thomas, our past president, he is the chairman of that committee. And then we have, again, AHPI is a part of the BIS committee, technical committee of BIS on health and sports and fitness. So AHPI is that way, even training sessions. We have conducted various training sessions across all the, healthcare ecosystem on various modules like healthcare quality, nursing excellence, infection control, communication in healthcare. So this is how we involve stakeholders and work together. And also, of course, we promote accreditation among our member hospitals, NABH accreditation.
Thank you, Mr. Khetarpal. So, final question to Dr. Chadha is how do you look at the main challenges that you see in promoting and sustaining the culture of quality improvement in the healthcare sector? So from Metropolis perspective as well as in general, and how do you propose overcoming these challenges?
Yeah, so, the challenges are diverse, right? First thing somebody brought about talent. Talent is very, very important, because if your basic education, your basic experience, and your basic, this thing is not all right, then you're not going to be able to, if you don't have that knowledge only, you're not going to be able to display this thing. That's why the whole concept of having specific people for specific needs is very important. Secondly, their orientation toward the job at hand, what the requirement is, that is very important. So we have something called as an M-Parichaya, in which we acclimatize the person to what he's supposed to be doing. We have something called as an M-Buddy, in which the person is, sort of held, by the buddy that, look, this is your job really. And then, we have something called as a Net Promoter Score, by which we actually come to know the promoters, the detractors, and it helps us to, again, clinch what was the real problem and what is the real solution. So as I said, we go very aggressive in this because there is no other way. You have to be aggressive in your pursuit of quality, and you have to have very clear quality indicators, risk assessment scores, net promoter score, which is actually telling you what, is the requirement. So I think aggression followed by good indices and leadership roles taking on the quest for quality and filling the talent positions, not at all, compromising over there, and then putting them on a constant learning management module. So we have something called as a LMS and a skill development. So constant skill development is also very, very important. So, yeah, that's the key.
Thank you, Dr. Chadha. So we've heard the panelists. I think if I try to just summarize it quickly, so quality starts the moment a patient walks into the hospital, and it's not something which is done for a day for passing the exam. It's something which needs to be there, evident and being practiced every single day, every single hour at institutions. And to enable that and to really get that going, what we hear is need to be the culture, and that culture, for promoting that culture of quality, it really needs to come top down from the leadership, and of course taking into account the capacity building and the right trainings that is required for the workforce, whether it is frontline or even at the mid-level leadership. So I think that we have a good takeaways from the panel, and I'm hopeful that everybody who is listening to it now or later will come across, will see how we can really take up these points and get our healthcare ecosystem to that desired quality. Thank you, all the esteemed panelists, and thank you to Business World once again for organizing this.